Hello, good evening, everyone. Welcome back to our session 5 of PLAB 2 Mind the Bleed, run by us, a group of junior doctors in the UK. I would like to just quickly introduce myself. My name is Dennis. I'm one of the FY1s currently working in Queen Alexandra Hospital as one of the IMGs. And I've recently passed PLAB not too long ago, so I was quite fortunate to pass every station. So hence I feel that I would need to share the tips with everyone and just guide everyone through what PLAB is about. And tonight I've got my team with me. Would you like to introduce yourself, everyone?
Hello, everybody. My name is Sanduni. I'm an F2 based at the Royal London Hospital. I did my PLAB exams in 2021 and 22, so not too long ago. So hopefully I'll be able to help you guys out a bit if I can. Otherwise, I'm just excited to be here, so I hope it's a good session.
Hi, everyone. My name is Rajni, and I'm the F1 at Stepping in Hospital in Stockport. I did my PLAB exam early last year. And I did it without attending any academy, so just by self-study. So sessions like these are really helpful because you don't have to pay for them. It's free and you're getting live feedback as to what improvements do you need. So I'm glad you can join today.
Mm-hmm. So I'm quite glad that we've got quite a small group tonight and it's just a few of us. So please feel free to be a volunteer and you'll receive feedback at the end of the session. And I will be talking a bit about the UK MLA and the PLAB 2 transitions, and I will move into a combined stations, which seems to gain popularity nowadays. And we've got a few tips around that, how to ace them, just because of how people find it tricky, just because of the time constraints. We're given 8 minutes, and you have to perform so many things during the exams. So for those who would like to volunteer, please do pop in the group chat and we will sort it out for you. We've got Razaz there as our moderator tonight. So I'm going to start with just a quick run through about what PLAB and UK MLA is. I've spoken to a few people and there are very clear guidelines, the content map on the GMC website, which you can have a look. Literally, I've copy and pasted the entire thing from the GMC website. It's going to be exactly the same thing, but it's just how they assess you will be different. So it's going to make more difference to the examiner than the candidates. You still have to be a junior doctor in the UK. You still have to practice safely. You still have to finish the cases. It's going to be 8 minutes and there will be 16 stations. So everything's going to be the same. So not to worry. I know a lot of people start to get a bit nervous about the transitioning and how it's going to affect them. So it's about readiness for safe practice, managing uncertainty, such as you have to manage unwell patients in SIMMEN, or you deliver person-centered care. So it's the 3 domains which you have practiced on and on about history taking, management, and interpersonal skills. So it's still going to be the 3 main domains. And this is the MLA content maps in the 6 domains. It's nothing new. And every university in the UK now would have to follow this content map. And even though for their own OSCE, they are run differently in each university. So they just have to follow the content map like what PLAB used to do. So it's nothing new. So not to worry. And we'll carry on with our combined stations tonight. And normally for combined stations, I think we've got a few new candidates who join us tonight. So I'm going to run through the first very important bits of tips that I find useful during the exams. First would be read the prompt again and again during the 1 minute 30 seconds prep. And secondly, try to be empathetic towards the patients, not to say the same things over and over again. This is what a lot of people struggle with. When they go to an academy, they were given a huge script to memorize, and then they sort of like regurgitate every single bit from that script alone. So you will be saying, I'm sorry whenever the patient say they're in pain. You'll be saying thank you whenever the patient tell you something, or you go in there, always ask them, can I ask you the question? So you don't have to do that. You just have to be yourself and practice the cases. So let's focus on the combined stations tonight. Combined stations, for the prompt itself, you would see, please talk to the patients, take a focus history. What would be the most important bits is take focus history. I don't want you to spend too much time asking unnecessary questions, because you have got only roughly 2 to 3 minutes to gather the history to roughly know what's going on, and then you have to move on to doing the examinations or doing the procedure. So let's only take focus history. And in terms of focus history, what you can ask is just presenting complaint. And most importantly, it's just to ask them, how can I help you? I've got pain. So do a quick pain run through the Socrates, but not to ask anything else. Do a quick differential diagnosis as well. Ask about the red flags that you're worried about, any weight loss, or anything that you feel is warranted a question. So if social history is not important, don't ask it. If you think smoking is not relevant to the case which you are doing, you don't have to ask. So past medical history is important because sometimes they will have some hint in there. And for examinations, you've got roughly about 2 to 3 minutes to ask to do the focus history. Then you have to move on. Even though if you feel like you've missed a few questions, that's fine. So in terms of examinations, during the exam itself, you will have a mannequin set at the side, and you will have that simulator or the patients there to talk to you. What most people struggle with is you didn't talk to the patient, so you would lose points in interpersonal skill. So examinations, before you do any examinations, even in real life or be it in an OSCE stations, you have to explain to them what you're going to do. Mr. Smith, I'm just going to do a quick examinations on you, if that's okay. I'm going to examine your foot, for example. I'm going to examine your breast, and you give them a brief history of what you're going to do. Like, I'm going to have a look, have a feel, and have a listen if it's auscultations is needed. And then you need to give them some privacy. I'll give you some privacy for you to get changed, but normally the patient will have already get changed anyway. So you look at the patients while you're talking, and then while you move on to the mannequin, because they will be at the side where you have to perform them, but keep looking at the patients to check if they're all right. So just say like, I will get a chaperone here with me, or just to ensure your privacy, or I've just get a chaperone here with me today. Is that all right with you? The consent is very important. So I can always ask a quick question. Is that all right with you? So let's begin. Just say, oh, so I'm just going to perform the examinations now. I'm going to expose you, and you can do the rest bits of examinations like inspection, palpation, percussion, auscultations. Again, only do the necessary examinations. If auscultations is not needed, for example, if it's a breast examinations, you only need inspection. You don't have to tell the examiner what you're doing. So it's more important to get the patients involved in your examinations. Just say, is there any pain? Is that all right? So keep checking with them, and always just talk to them, see what the findings are. And you have to explain it to them rather than examiners. I know OSCE in some countries, for example, where I was trained, you have to talk to the examiner, we have to run them through what you're going to do. But that's not the case in PLAB 2. So in PLAB 2, talk to the patients so that you can get that interpersonal skill in. I know it's quite nerve-wracking. You've got 8 minutes to run everything through. So just keep practicing. If you have got an academy that you normally go to the academy, practice with a study partner, and run through every single bits of examinations, which I will talk about later. And then you move on. Okay, so about 4 minutes, I would say, is sufficient for you to do any examinations or procedure that you want to do. Even if you don't, try to finish it when the ring comes out. So when there's like 2 minutes remaining, when you hear that, try to wrap it up as quickly as you could, because management still costs you 4 points. So for management, as a junior doctors anyway, we're not coming up with some brilliant management. We normally just do a quick symptomatic management, painkillers, give them antiemetics, give them fluids, and then you have to decide whether you admit them or not. You can always assess the red flags, ask them, even when you want to admit them, just tell them, we'll have to admit you for further investigations. Is that all right? And then you have to speak to a senior. So you don't have to spend too much time on management. You just have to explain to them what your examination was and what you thought the diagnosis was. And then you treat them symptomatically, admit them, or speak to a senior. And that's all. So in terms of examinations, these are the things that I was talking about. So explain it to them, getting consent, chaperone, ask if there's any pain. Always start with ask if there's any pain, so that you don't want like a testicular torsion. You don't want to just go in and start squeezing them. That's not very nice and you're not going to pass. So explain the findings while you can run them through while you were doing it. And just going to have a feel of your tummy. Is there any pain over here, sir? That's all. So you don't actually would need to spend too much time. Even for inspection, I'm just going to have a quick look at your tummy. So for a surgery case base, you can ask them if they've had previous surgeries for that. You can look for scars. You can look for any skin changes and things like that. And these are the examinations part of the exams where they will come through as a combined stations. Will be procedures such as venesection, taking bloods, paracetamol overdose cannulations, ABG catheterizations. And I've got previous candidates who ask me, how are they running these kind of things? So they will come in, patient has got pain. Please do take bloods from the patients, but you still have to go into the stations, sit down, speak to the patients, take a focus history, and then say, for this purpose, Mr. Smith, I'll need to take some bloods from you, if that's all right. If it's a blood culture, you can say, we need to take something called a blood culture just to see if grown any bugs in it. Normally, patient will come in with a fever. So your focus history should focus around identifying the source of infection if you could. Any cough, any burning sensation in the urine, just try to identify the source of the infection. And abdominal exam is quite a popular one. And most, I would say all of them are surgical case basis. So you just have to know, if you get an abdominal exam, just know where the pain is. And there's a little tip in that. If it's acute cholecystitis, you know the very typical sign. And normally, PLAB 2 exam is not here to trick you. It's quite a simple exam. They will give you the most typical sign. So if it's tender, the patient will tell you it's very tender on the right upper quadrant, doctor. And then you roughly know what it is. Even if you don't, you can always say, you can be honest with them. If it's some of the cases which is quite unclear, you can be honest with them. So at the end of the cases, when during management time, so I've examined your abdomen, Mr. Smith, and you've got a little bit of tenderness on your right upper quadrant or your epigastric or your upper abdomen, but unfortunately, I'm not too sure what it is, but I will find out for you. We'll need to do further investigation. They will not fail you just because you don't know the diagnosis, but if you can do the rest of the cases well, you will still get a pass. Like you will still get an 8 or a 9 because you did a good interpersonal skill, you did a good history taking, but you lose some points on management. But if you manage them symptomatically, there's no reason why they would fail you in that stations. You can always be honest with them rather than just guessing any random diagnosis, I would say. So just say, unfortunately, I don't know what it is, but we'll need to do more investigations or possibly a scan to find out what could be happening. And I will speak to my seniors. And that's all. Just be honest with them. And I'm sure the examiner will appreciate it as well, because as a junior doctor, patients come in with abdominal pain. I would say 8 out of 10 cases, you don't know what the exact causes is. So you can just do the basic, always do the basic, and that's enough. And the next one will be breast examinations, which is rather popular nowadays, and testicular exams. And these two, I would say they would take quite a lot of time, like otoscope and ophthalmoscope. So what I would suggest is when you go to the academy, try to play around with the instrument that they have got, the ophthalmoscope or the otoscope. And normally in an academy, they have got the exact similar model, or if not similar ones to the one that you're using during the exam. So make sure you familiarize yourself with how to use them so that you won't panic during the exam. Oh no, how do I turn it on? Like I've seen candidates who struggle during the exam and they were nervous. They don't know, they forgot how to turn it on. So it will waste a lot of time while you're trying to fiddle around with the instruments. And the antenatal exam as well, but they're not, I haven't seen them for a few months now, actually, for quite some times. So for examinations, do focus on the first beats of this. I would advise you. So anything that you want to add, team?
No, I think you covered pretty much everything, Dennis.
Okay, cool. So who is the volunteers for tonight's case? Is it, so the first case, would it, Patricia, would you want to be the volunteers? Or we've got someone who asked, do we start by asking open questions? You always start by asking open questions. So you go in and say, how can I help you today? Or you can just, what brought you into the hospital? That will be the same in any case, I would say. Just because most of the simulators, most of the patients would tell you what they're in. They're not there to torture you. So they will give you a lot of information. If you're nice to them, they'll give you more information than they're supposed to be anyway. So who would like to be the volunteers? Patricia? Okay. Razaz, do you mind adding Patricia onto the stage, please?
Yes, of course. 1 second. You're in the stage now, Patricia, I believe.
Hi, hello. Me? Sorry.
Hello.
You see me? Hi, hello.
Yeah.
So for those who have not attended the session, we will use this timer, which is exactly the same during the examinations. You will hear, you'll be given 1 minute 30 seconds you'll be given 1 minute
Dennis,
to read.
you're I can hear you twice.
Oh. Is it an echo from me? Is it better now? Okay, sounds better now. So you'll be given 1 minute 30 seconds to read the prompt. I think it's the echo coming from Patricia's.
Oh,
Okay.
hello.
Fine. Hello? Okay, I think, can you still hear my echo?
Yes, unfortunately, I can still hear you echo. And my own. Patricia, can you mute yourself for a second?
Okay.
All right, let's test it out. I think it should be okay now. I think the echo is coming from Patricia's speaker. Is that right?
Yeah.
Yeah, sounds like it.
Okay. Maybe I can try to join again? Like,
Yeah, let's try
Yeah.
that.
Okay. So let me, Patricia has joined our session before, but let me just have a quick run through of how our scenario works. So you'll be given 1 minute, 30 seconds to read the prompt. I want you to utilize it. Try to formulate what questions you want to ask, what you want to do. In terms of examinations, I want you to talk to the patients. So talk to our moderator tonight, what you are going to do. And you don't actually have to do it, but in your mind, I want you to run through what you are doing.
hi, hello. Is it still sounding weird?
Yeah. Yeah, there's still echo.
Oh, what do I do?
Have you got an earphone that you can?
Yes. But I need to go and pick them up. So maybe someone else take the first case and then I'll do the second one.
Yeah, of course, of course.
Yeah,
Sorry.
let's do that.
Thank you.
Sorry about that. Sorry about the technical issues.
Ashnabi, can I put you? I'm going to invite you to stage, if that's all right. Okay. Are you happy to start first? I know you wanted the second case, but just...
Yeah, I'm happy.
Okay, fine.
Perfect. Thank you.
So are you familiar with how we are going to run the cases tonight? Are you quite happy?
Yeah.
Okay. So you'll be given 1 minute, 30 seconds. Yeah, are you ready?
Yeah. Yeah.
Begin. Enter the room.
Hello, I'm one of the doctors in the emergency department today. I am Mr. Smith.
Yes, hi, doctor. Yes, I am Peter Smith.
Right. Could you please confirm your date of birth for me?
My date, I'm 30 years old.
Okay. Right. Right, Mr. Smith. Could I see that you're here with the pain in tummy?
Yeah, that's right.
Could you please tell me more about this pain?
I've just got this pain in my tummy, which started like a couple of days ago.
Mm-hmm. And where exactly is it?
It's just in my whole abdomen, whole tummy. It's just very painful.
Okay. Okay. Can I ask how did it first start?
It just appeared on its own
Mm-hmm.
just a couple of days ago.
Okay. It just started suddenly, and
Yeah.
it's present the whole of the tummy. How's the pain? Is it sharp or it's like dull?
And it's kind of like colicky.
Okay, that's right. Have you noticed anything which was increasing the pain or something? No.
No, it's just nothing is nothing. It's just there, and nothing is sort of increasing the pain.
Okay. Have you noticed something which was relieving it, like when you was sitting or while you were lying down?
No, it's just constantly there.
Oh gosh. So have you noticed any other symptoms along with the pain, like vomitings or, changes with your bowel?
Yes, I've been vomiting since yesterday,
Oh, that's fine. Mm-hmm.
but I've not had any
So,
bowel changes because I've not opened my bowels.
okay. Do you feel that means you're feeling a bit constipated at the moment, is it?
Yeah, I would say so. Yeah.
Right. Okay. Are you running any temperatures by any chance? Do you feel chills or?
No.
Okay, it's all right. How many times, if I may ask, how many times have you vomited since the
I
pain?
think around 4 to 5 times yesterday, since
Okay,
yesterday.
that's bad. Okay. So, just a background check with your medical, how were you doing before this? Did you ever have this pain or was this the first time?
It's the first time, doctor.
Right. Okay. So have you noticed any changes with your weight?
No.
Okay. Any lumps or bumps anywhere else? Have you,
No, not that I've noticed, no.
by any chance, have you hurt yourself? I mean, like falling or what?
No, absolutely not, no.
That's okay. Okay. Was there anything? I mean, have you noticed if the food is triggered? Any outside food, or if you did eat?
No, I just ate my dinner at home. I don't usually eat outside.
Okay, that's all right. Um, and so you said this is the first time. A couple. Please bear with me while this. Background check may have an impact on this. So, by any chance, is there any long-term medical conditions with you that I should be aware of?
No,
Okay.
no.
By which I mean, high
I'm
blood
30 years
pressures.
old. I'm quite fit. No.
That's good. That's good to know that you were fit and healthy, but now that so right now, Smith, what are you more worried about?
Just this
I know you're
pain
in
and just
pain,
vomiting, yeah.
right?
And just fact that I feel very, very, because I'm not open my bowels. It's very uncomfortable
It's
situation.
uneasy. Yeah, I
Yeah,
get that.
yeah.
Have you had any thoughts about what's all going on regarding this? Why
No.
is this okay? It's all right. So since you're in the pain, if I may ask, could you please score the pain for me? Say 0 being the least and 10 being the highest.
I think it's around like 4 or 5, I would say.
Okay, 4, 5. Okay. So since you're in pain, have you had any issues with the, breathing and difficulty because you feel a bit.
No, doctor, no.
Okay, right. Is it okay if I go on to examine you? By which I mean, I may first I'll do a couple of numbers by checking your blood pressure, your heart rate, your respiratory rate, and of course record your temperature or the urine run just to see if things okay there. And also I may have to feel your tummy. Just look, feel, and assess if there is something going on. And listen to your bowel sounds. That's okay. I may have to, just expose you with the belly to see what's going on. And I would have a chaperone with me. Is that all
That's
right?
fine. That's fine, doctor, yeah. I'll give you the findings now. So on examination, the abdomen is distended. It's tympanic sound on percussion of the abdomen due to air-filled stomach and high-pitched bowel sounds.
All right. Thank you, Mr. Smith, for letting me examining you. It looks like there is quite an acute thing, by which I mean there is tenderness in the abdomen, and it looks like something emergency, and we may have to admit you at this point.
What do you mean by emergency, doctor? What's going on?
So right. You feel your stomach. You mentioned that there's feel constipated, and the stomach looks bulging, and you did come up with a couple of times. I'm suspecting there is something called as acute pancreatitis going on with you, but I'm not convinced at this point. So this is something which we need to worry about. Are you still with me, Mr. Smith?
Yes, doctor, I am. I'm just trying to understand what's going on, that's all.
2 minutes remain.
Right. So at this point, the reason I wanted to admit you was to see what's going on with you, by which I'll be doing a couple of blood tests while you're here, and I might involve my team, colleague, to see help understand with your symptoms. But meanwhile, I would give you a painkiller, and since you vomited a couple of times, and we may give you an antiemetic. I mean, to control the sickness.
Okay, doctor. Thank you so much.
Uh, all right. At this point, have you any questions, or are you expecting?
No, I don't have any questions, doctor. Thank you. Thank you. I suppose I'll get admitted tonight. Is that
Okay.
correct?
Right. I mean, I would suggest if that's okay. So, is there anyone else with you? I mean,
Yeah, my girlfriend is here with me.
okay, that's good. Good to have someone around when, especially, you're getting to the hospital. So, while we go through this, could I just run through your lifestyle if that's okay? Because there are certain things which can affect your present situation.
Yeah, of course.
While we are waiting for the ambulance. Okay.
Yeah.
So, can I ask if you smoke or if you drink alcohol?
Yeah, I smoke around 20, I would say like a couple of packs, 20 cigarettes.
Okay, that's a lot. And have
Yeah.
you had any thoughts about cutting this down?
Not at this moment. I've got very stressful job, doctor. So that's what really keeps me going. So I have no intention of quitting at the moment.
Right, we can talk about this and going forward. Do you also drink, Smith?
Yes, I do. Yeah.
Okay, and how much do you drink?
I would say like between 5 to 10 pints a day.
Time's up. So, how did you feel about the case? How you did?
I think I rushed to the management without taking the psychosocial history because I was just focused. I need to get to the management.
Yeah.
Oh,
But you
but
did finish. You did finish. I mean, you did technically get to the management, but I will give more time during the exams for you to actually walk to where they put the mannequin and actually perform the examinations because you can't rush through the examinations. But how about our patients? How do you feel? How these doctors? How's the consultations gone? Do you feel like you've been listened to?
Okay, I'll start with the positive first. You were very attentive. You were polite in the way you spoke to the patient, me. You asked open-ended question. You gave me opportunity to answer. It was not just yes and no, which was really good. You forgot about lifestyle, but you went back to it in the end, so it still counts. Only thing I would say is in terms of your history, just think of it being a tiny bit more organized in terms of asking about all the pain related history. Think of an acronym which you find you'll be able to remember in the exam. When you start with the pain, start with where is the pain? When did the pain start? Are you taking any pain relief? Is it helping? What are the symptoms which you obviously asked already? And then you can ask the pain radiating because that's going to help you with the differentials as well. If the pain is radiating somewhere, it
oh,
might.
I forgot about that.
Yeah, but it's fine. I
Right.
mean, obviously, this was the first time practicing. But apart from that, yeah, I would say doesn't matter that you didn't reach the diagnosis. That's just one part of it. But collectively, your communication skills were great. Interpersonal skills were great. You asked lots of questions. I imagine, Dennis, would you agree? There'd be lots of check. You did achieve.
Yeah. But what do you think the diagnosis was based on these findings that you can see on the screen?
I just thought it was an acute abdomen, but I don't know what is it. The tympanic sound could be, maybe when she said, when Dr. Rajni said colicky pain, I'm not sure about the diagnosis. There are lots of things going on in my mind. Sorry about that.
That's all right. Acute abdomen, what would be the very classical sign you will see quite a lot if you're working in surgical? Pain, tender everywhere, generalized pain all over, vomiting, not opening bowel. So obstruction.
Oh, right.
So acute abdomen, you are there. It's acute abdomen is correct. But for pancreatitis kind of pain, it will be more epigastric and it will be more radiate to the back. Sort of like they're normally very dry. Patients will present very dry. And the causes, I mean, So for acute abdomen, you've always need to give the painkillers, and you have to decompress them. That will be the most important management, but you have to confirm it first.
Okay.
So, but I like how you actually you've done quite a good history taking. But if not, I would say you spent a bit too much time on it. I will take an even more focused history. So pain, I've got pain. Focus only pain. You finish pain. Any other symptoms? I've got bowel. I haven't opened my bowels. I've got vomiting. So how long has it been? That's it. Not too many questions. Move on to past medical history. What other medical history do you have? Do you take medications? That's it. Done. So you could do a quick eyes to get your interpersonal skill point in. Have you had any ideas what this can be? Job done. So always go back to the examinations, because during the exams, you actually need to spend time examining the patients. I know this virtual scenarios is not the most ideal, but spending time examining the patients will also score you interpersonal skill, because you'll be talking to the patients at the same time, telling them what you're doing, and you have to guide them through what it can be, and you did reassure them. So I think you did very well on interpersonal skill and history taking. But you just have to be a bit more confident in your diagnosis. If you think what that is, it is what it is, because you've practiced enough, and I'm sure you've done enough cases to know what could be the diagnosis. It's not the end of the world if you don't come to that diagnosis anyway. All right.
Can I ask one question, sir?
Yeah.
Although I said acute abdomen, then I went on to say acute pancreatitis. Would I lose a mark? Because technically it was not pancreatitis, and it is an obstruction case.
You would, if you got the management, like I've mentioned like I've said previously, if you got all the management right, even though you've got the wrong diagnosis, they can't penalize you based on that. It's still an acute abdomen, but you will not score very high, or you'll be sort of like borderline, because in terms of history taking, you have gotten the more ideas on what it is based on the history taking. So they will cost you some points of history taking and your management as well. Because you haven't decompressed them. You're not going to decompress them if it's a pancreatitis, is it?
Yeah. Also, I wanted to add one other point, because there was acute abdomen tenderness. I wanted to advise the patient that she shouldn't be taking anything orally. And we would put her on IV fluids. That's the reason we wanted to admit her.
Yes.
So,
yes. So you know the management. You know the management. So there's no problem. I'm very confident during the exam. I'm very confident that if you got the diagnosis right, you get the management. It's about the confidence coming to make a decision of what you think the diagnosis is.
Okay. Thank you.
All right. No problem.
Thank you.
Right. Second case.
Actually, hang on. I took some notes down. At one point, sorry, if I'm not trying to be mean. You said words like antiemetic and acute pancreatitis, and you didn't actually explain them. I think you need to use more layman's terms, or just like, even if you use these words, just explain yourself a little bit. And when the patient said that they smoked, I think 20 cigarettes a day, you said that's a lot. Maybe keep that to yourself. Just fine. Honestly, you did really well. It's just that was one thing that I noticed. You were a bit nervous, weren't you? Yeah.
Was that same?
Everyone's nervous. Don't worry about it. It's fine. I was so nervous during my exam. But I think if you practice the order, like the sequence of things to ask during the history, it'll just come more naturally, because you don't have to think about it. It'll come. Because it felt a bit disorganized, because you asked about, I think you forgot to ask about family history. Did you ask? I might have.
No, I did not. No, I just thought to rush to the examination bit, and probably that's where
it is a matter of time management, but also felt a bit disorganized. But your practice just makes perfect, I guess. And then at one point you did ask some leading questions. For an example, the character of the pain. You asked, is it dull or sharp? How does it feel? I think you could have just said how
to make relevance.
what like you could make an open question and be like, what did you feel was the like, how would you describe the character of your pain? And then if they couldn't answer, you could give them a few examples, but now immediately the patient is thinking, is it dull or is it sharp, you know? Yeah, but you did really well, honestly, really good.
Thank you. I just get a lot, I start with my open-ended question and then get back to the colors, which is just becoming grayish, and that's what. And about my structurism. Yeah, that's it.
It's just practicing will make it better, but honestly, you're already great. Just keep trying.
Thank you so much for the feedback. I mean, it was very valuable. And one more question, since you mentioned about the smoking, should we reflect then and there about the smoking, or can we just say that we can come on to that a bit later?
That's such a good question, right? The thing is, Dennis, correct me if I'm wrong, and even Rajni, smoking is like the patient's in an acute pain.
Emergency case. Should we reflect on that?
Should we be going like it's been some time, so I might remember it wrong.
If it's counseling, yes, certainly. If it's combined stations, you don't have time. Move on.
Yeah.
You can just mention in the end, because you always mention the plan to the patient in the end. So you say to them, what you have right now is something, it's an emergency. We'll give you some IV fluids. We will put an NG tube down your nose to decompress your stomach. We're going to give you some pain relief. And you mentioned about that you smoke so many cigarettes. That is something, obviously, we'd like to have a discussion with you, because we've got a very good team here who can help you support with quitting smoking. If you just throw it there, then you've acknowledged the patient's smoking problem, and you've acknowledged that in ideal scenario, you would deal with it, because you only got 10 minutes. You can't do it now, which we do it day in, day out. When in our practice, we say, okay, have you considered quitting? They say, oh, well, not at the moment. Okay, that's something we can discuss later. And then we make a referral, and then some cure team, whatever team we have, they come back and see the patient. But it's good to acknowledge, because you acknowledge something, a lifestyle modification that needed, especially in this patient. Smoking is kind of like a risk factor for what this patient presents with, which is the bowel obstruction. So it's definitely something that you would need to very, very, very briefly, because you don't want to waste too much time. It's not a counseling session, as Dennis said. The station is about completely different thing. So just acknowledge, and that you probably just get your tick box that you need.
And also, I feel like it might be safer to just not give a diagnosis if you're not very sure, and keep it vague instead of going acute pancreatitis. Just, better to be sort of right than completely wrong.
You can always say in the end, I'm not quite sure what's going on, but you can give them like a generic management. Even if you don't know any abdominal pain, it's always safe to keep the nil by mouth and just say, we're just going to keep the nil by mouth for now, and I'm going to get help from my senior doctors who might be able to help me reach a diagnosis here. And just say, we might be order some imaging, and just leave it there. It could be X-ray, it could be CT scan, which in that sense, you have acknowledged that you're a safe doctor. You will ask for senior help when you don't know what the diagnosis is, but you still know the basic management for acute abdomen. That's because I've had this scenario where I didn't know what the diagnosis was, but I just said, well, I will do this, and I will get a senior help or senior involved, and I passed that station. So.
Yeah, I feel like it's really important to understand that you're not expected to know everything. You're supposed to work at the level of an F2. I'm an F2. I don't know what I'm doing half the time. You're supposed to ask for help. That's why there are grades in training. So it's fine to not know.
They're looking for safe doctors more than anything, to be honest. You would rather fail if you didn't say, I would involve a senior for advice or for a senior review, than to say, I will involve them.
Great. Thank you so much for your feedback. Really helpful. Thank you. Thank you.
Thank you very much. So we'll move on to the second case. Patricia, are you ready? Razaz, do you mind just inviting her onto the stage, please?
I did.
There she is. Hello. Oh, we can't hear you.
What about now?
Yep, perfect.
It sounds good?
Yep.
Okay, good.
Okay, cool.
Yeah.
Right, are you ready?
Yeah, that's fine.
Let me just get the timer ready. So it's 1.5 minutes. For examinations, try to talk us through what you're going to do. Like, for not us, I mean to the patients. Okay?
Mm.
Begin. Enter the room.
Patricia Costa Carrasco, my GMC number is 12345. Hello.
Hello.
Hello, Patricia. I'm one of the unit doctors working in this department. Can I confirm your name and age, please?
Hi, my name is Martin Atkinson. I am a 60-year-old.
Okay, nice to meet you, Martin. How can we help you today?
I've got a really bad tummy pain, doctor. It's sort of up on my right side and it's really bothering me.
Okay, so Martin, I know this is very frustrating for you to be experiencing these symptoms, but you did very well to come to see us, and we're here to help you. Are you in, is it okay for you to talk?
Yeah, I'm happy to answer some questions.
Okay, that's good. So could you tell me a little bit more about this pain?
This I don't know, it's just it's on my right hand side, up on top, and it started, I want to say, this morning.
Okay.
It's just yeah, I don't know what it is, doctor.
Okay, were you doing anything with it when it started?
It just kind of started, it just showed up. Wasn't doing anything.
Okay, the pain is always there or comes and goes in waves?
It's kind of always there, yeah, I'd say there.
Okay, since it started, do you feel like it's getting worse or
Yes.
better? And is it going somewhere else?
No, it's not really traveling anywhere, it's just kind of there.
Okay. And is there anything that makes it better?
Nothing's made it better. No.
Okay, anything that makes it worse?
Yeah, I feel like it gets worse when I try to take a deep breath.
Okay. Okay. Have you taken anything for this pain?
No, I haven't tried any.
Okay. And if you have to score your pain from 1 to 10, being 1 the lowest pain and then the worst pain you ever felt, how would you score it?
An 8 or a 9? It's quite bad.
Okay. Yeah. Oh, I'm sorry.
Yeah.
I know, like I said, frustrating, but we're here to help you. Just bear with me. And any other symptom apart from this pain?
I don't know, what kind of symptoms are you thinking of, doctor?
Any fever?
Yeah, I
Any
think I don't know, I haven't measured my temperature, but I've been feeling a bit hot and cold.
Okay, since this morning. Oh,
Yeah.
okay. Apart from this, any other symptom?
No, that's it.
Okay, nausea, vomiting.
No, not really, no.
Okay. And just another question is do you have any medical conditions by any chance?
No, I'm fit and well. I'm a 6-year-old
Okay.
man.
Okay, and do you have any idea yourself what could be the cause of this pain?
I have no idea. That's why I'm here. Hoping you
Yeah.
can fix it.
Okay.
Yeah.
So, Martin, if it's okay for you, I would like to examine you. Yeah.
Yeah,
So,
that's fine.
so we're going to take some bedside tests that will include your blood pressure, your breathing rate, oxygen, temperature, and we're also going to take. I would like to examine your chest to have a listen to your heart and your lungs, but mainly I would like to have a feel on your tummy, if that's
Yeah,
all right.
that's
Yeah,
great.
okay. So what I'm going to do is well, we're gonna sorry. So we are going to we need to expose your tummy all the way to the just below your chest. And I will have a chaperone with me, and I will try to be very gentle. If there's any pain at all, please let me know. Yeah. Is that okay for you, Martin?
Yep, that's great. Thank you.
So first I will start with having a look. And if there's any changes in color or any changes in the shape or uh, anything that could be visible, then I will proceed with gentle palpation, and I will try to start away from the right side, which is the painful area. Sorry, is that okay, Martin? Sorry.
That's great. Yeah.
Yeah. And then if the patient tolerates, I will slowly go down to the painful area. And then I would do a little bit of deeper palpation, and I will do it clockwise, and trying to keep that system with a superficial palpation and then with a deep palpation. Oh, sorry, it's just I feel like I'm just stuck in my brain. Um, and then I would like to auscultate as well. And I would like to do a special test. So, Martin, I will have to palpate very deep on the right side where the pain is. But I need you to take a deep breath, and then if it's unbearable, just let me know. Yes. And then I will proceed with my special test. And then
2 minutes remaining.
just one second. So Martin, just bear with me 1 second. Okay. Martin, I would also like to do some more like initial blood tests, just to have a check on your cell count, look for any signs of anemia, inflammation, or signs of infection. I will also have I would like to see your kidney function, liver function, have a look in your sugar levels. I will also would like to do a urine test. Yeah, if
Okay.
that's okay for you. And yeah. So,
Do you have
so
any idea what might be wrong with me, doctor?
and this is a very valid concern. So, Martin, from what we have done so far and what we have discussed, it seems to me that you are having an infection. My impression is that it might be related. Well, I know it might not be with the age, sorry, but I'm thinking about a sort of infection that it comes from the urinary from urinary infection. So, but we need to run further tests to begin get to the right diagnosis. How does it sound to you, Martin?
That sounds great. Thank you.
Okay, so what I would like to do is, if you are happy, we would like to admit you to keep up with us for a little bit. We would like to observe you, keep checking your vitals, well, your blood pressure and temperature mainly. We're also
Move on to
going
the
to,
next station.
Thank you.
Done.
Thank you.
Thank you.
So how do you feel? I normally
Well,
start with asking you, yes.
yeah, that's okay. I think I got a bit confused. It's online. I think it's not and how to explain my abdomen examination in order with I think it was hard to imagine that I was doing it and then explaining to the patient at the same time. So maybe yes, I do need more practice with that. How to explain to the patient like every step of the way without sounding too doctorish.
Mhm.
Okay.
Yeah,
Right.
and also the diagnosis as well.
Sanduni, do you want to carry on?
Yeah. You are a very kind doctor. I felt listened to. I don't think you covered all of the history. I don't think you did all of the Socrates. I wanted to tell you my pain was sharp, but I didn't get a chance to.
Oh yeah, I'm sorry.
Yeah. And then in terms of all the other aspects of history taking, I'm not sure how you got to the UTI because you didn't ask me about my urine.
Yeah, I was thinking of that. Like, oh, you
Yeah.
must go. Great.
And also, if I tell you that the breathing gets difficult when I take, like, the breathing makes it worse. I think you need to sort of narrow down your differentials a bit. Are we thinking abdomen? Are we thinking like PE? It's not a PE, but I feel like it might have helped to like just rule that out a bit. I don't think you asked me for any allergies, regular medications. You did ask me for any medical conditions. You didn't ask me for family history or if I smoke or drink, how my diet is. I don't think you asked me. Did you ask me about my bowels? I'm not sure if you did. But yeah. And then when it came to the examination, I'm not sure you need to go so far in depth saying, you know, a superficial palpation, deep palpation. You can just say, I'm going to put my hand on your tummy and feel around a bit. Let me know if anything hurts. And then just do your thing. I don't think you need to spend as much time on the examination because this wasn't an examination station. It was a history taking station. I think that's all I can think of right now, but I'll get back to you.
Right. So yeah, sorry. It's supposed to be a focus. So it's supposed to be a combined station. Sorry, I didn't make that quite clear. So if it's a combined stations, you did the right thing. Focus history. That's it. You've asked enough history, but how do you come? You started very strong. I would say you started the case very strong. You're very confident in your pain-taking history, like your Socrates. You move on really well, very confidently move on. And you've got, but on the examination part, I think that's the point where you don't know what you want to what you want to explain to the patients. Like when I say talk to the patients about your examinations, I would just a simple one. I'm gonna have a look at your tummy. I'm gonna have a quick feel and let me know if there's any pain. So when you're laying your hands on the tummy, just do a palpations like what you do. You don't have to explain to them, but you can let them know. Let me know if there's any pain, or just ask them quickly, is there any pain when I press on here? So you don't have to explain to them what superficial palpation is, what deep palpation is. You will be essentially wasting too much time. And that's the reason why you didn't come to the management bits. But if you shorten that bit out, you will have about 1 or 2 minutes. I was looking at the timer. You will have about 1 or 2 minutes, which is very comfortable for you to finish your management. But again, coming to diagnosis, a lot of people struggle with that because under exam pressure, especially also like session like this where you have to perform in the crowd, in public, so you will struggle with what diagnosis can it be, and you would, because sometimes due to pressure, you feel obligated to come up with a diagnosis and you would just guess. So it's not going to help if you come up with a completely wrong, different diagnosis. But if it's similar, that's fine. So like I've mentioned in the first part of teaching, it's fine to be completely honest with them And in this case, you did well by doing urine dip, because abdominal pain, you need a urine dip test. This is the most basic one, where even a lot of F1, F2 nowadays don't even request for or look at it when patients present with abdominal pain. So I think you did very well, but it's just about coming to diagnosis and get the management in. In this case itself, you didn't get any points for management because you didn't address who's got pain, just painkiller, simple painkiller. You can request more scan, give some IV fluids. Patients, if it's nauseous, if patients vomiting, normally if patients presented with cases like acute cholecystitis, patient will be vomiting or have been very nauseous. So you could address those things. And that's it, very simple management, and you'll be done. So it was 2 minutes maximum for management, I say, will be enough. All right. But you've done well. I mean, I can see that confidence kicking. You've attended our previous session. I can actually see that confidence. You're very laid back, which would actually help. Trust me, it would actually help during the exam. Like if you can do this during an exam, be laid back, be confident, structure. You've got really structured history taking, which I think is a strong point. You started the case really well. You have left a good impression to the examiner, I would say. So that was my impression when you started the case, but you just sort of sway a bit towards the end of the stations. All right, but carry on. You did well.
I do just want to say I agree with Dennis. You came across as very confident, which was very reassuring as a patient. So well done.
Yeah, and very nice to the patients. I'm quite happy to give you 4 points as interpersonal skill because you sound very sincere. You're not the kind of candidate who say I'm sorry every time. So you sound very sincere. That's what's different that's what makes you different from other candidates. Have you got anything to add, Rajni?
Not specifically. I think you both covered pretty much everything. You sounded very confident and you were quite empathetic towards the patient's pain. Just a general comment. It's nothing. So both cases, this and the one before, both were male patients. So if you get a female patient instead, always bear in mind you will have to ask the gynecological history as well. So bear in mind you might need 1 extra minute because you want to rule out all the gynecology causes as well for pain. Is it PID, things like discharge and stuff? Is PID, thinking more like towards the menstrual cycle, things like that. It's always worth keeping in mind whether your patient is male or female, because sometimes you forget when you start taking the history and you realize, oh, halfway through, it's actually a male patient or a female patient. So it's just worth keeping that in mind to give yourself a little bit more time. If you get a female patient exam with abdominal pains, then your differentials widely changes as well. But yeah, apart from that, it was really good.
Thank you very much. Thank you.
Well done. Anyone else would like to volunteer for the next case?
I was going to ask Patricia again if she wanted to be here.
Would you like to?
1 second. Hi, hello. Yeah, sure. Let's go.
I mean, it's really good. We can actually see you. We were actually talking about you at the beginning of our session. We can actually see you improving from session to session, which is brilliant.
Thank you.
I see 2 more people. Do they not want to volunteer with us?
I did write in the comment section. They have not said anything to me.
Right. Okay. No worries.
There's a problem. There's a question by Vaishnavi asked if there's a problem. I think there's an infection in your gallbladder. That's it. Simple.
Oh.
So you don't have to come up with very difficult terms. Just explain in layman terms. It's not an MRCP exam. It's just a PLAB 2 exam. Right. So case 3. Let's get everything ready.
Just before we begin, I was not actually planning on being acting for this case, so I also have to remind that I am a PLAB examiner and I cannot actually give any feedback. I'm just being an actor for this session. That's all.
We've got the rest of us to give feedback. Don't worry. Thank you. Right.
Begin.
Again, this will be combined stations.
Enter the room.
Patricia Costa Carrasco, my GMC number is 12345. Hello.
Hi.
Hello, Patricia. I'm one of the unit doctors working in this department. May I confirm your full name and age, please?
My name is Rachel. I'm 45 years old.
Okay, nice to meet you, Rachel. I can see that you are in pain. Is it okay for you to talk?
I can talk, but I'm just in a lot of pain. I've taken some paracetamol, but it hasn't helped.
Okay. Rachel, I know this is very difficult for you, and promise I'll try to be very quick, but I need to ask you a few questions so I can be in a better position to help you. So if I'm correct, you came here because of pain? Could you
Yes.
tell me a little bit more about this?
It started yesterday, but it wasn't this bad. It just gotten worse and worse overnight, and this morning it was really bad.
Okay. Could you tell me a little bit more about this pain?
Like what?
Oh, so you said that started yesterday. Do you remember how this started?
Just suddenly, I was watching TV.
Okay. And how could you describe the pain for me, please?
It's sharp.
Okay. Is it going somewhere else?
It goes to my back weirdly. I don't know why.
Okay. Apart from your back, does it go somewhere else?
No,
Anything that makes it better?
no,
Okay. Anything that makes it worse?
no. Come to think of it, if I lean forward a little bit, it actually feels a bit better.
Okay. Okay. And is well, I know it might be a little bit obvious, but since it started, do you think it's getting worse?
Yes, it got much worse than yesterday.
Yeah. And if you could score your pain for me, being 0, no pain, and 10, the worst pain you ever felt, how will you
This is
score it?
definitely the worst pain I've ever felt.
Yeah. Okay. I'm sorry to hear this. But like I said, we're here to help you. Just bear with me a few moments. Apart from this pain, do you feel anything else?
No,
Okay. Any fever?
no,
No. Okay. Any nausea, vomiting?
I have been really nauseous, but I haven't vomited.
Okay. And it started with the pain?
Yeah,
Yeah. Anything else? Pretty much one thing. That you feel shortness of breath?
no.
Okay. So I would like to ask you a few more questions. Um, this does you when was your last period?
A week ago.
Okay, and have you had any problems with your periods?
Never. They're always regular.
Okay, okay. Any discharges?
No.
Okay, that's good. Any problems with your urine?
No, it's fine.
No, that's okay. Okay. And do you have any medical conditions by any chance?
No, I haven't been diagnosed with anything.
Okay. And apart from the painkillers that you mentioned that you're taking, do you take any other medications?
No.
Okay. Any other allergies? Sorry, any
No.
allergies? Okay, that's okay. I think that's what I'm gonna ask you right now. I don't want to disturb more. Is it okay for you, Rachel, if I examine you?
Yeah, okay.
Yeah.
Just
So
just
I
don't
will
push too hard.
try to be very, very careful. So what I'm going to do is we are going to examine your abdomen. Well, first, sorry, we're gonna take your blood pressure, breathing rate, temperature, oxygen level, and I would like to examine your abdomen. And for this, I will ask the chaperone to be with me. Is that okay for you, Rachel?
That's
Yeah.
fine.
So I would like to so we would need to expose your tummy, and I will try to be very gentle, but I will need to palpate. Okay.
Okay.
Yep. Okay, and then I will do the examination.
Okay.
Yeah. Oh, see. Very well. So very well. So do you have well so we have done after this examination, I would like to also do more investigations.
2 more minutes.
Mhm. So sorry, Dennis, sorry.
2 more minutes. Sorry. Carry on.
Okay. I would like to do more investigations. I would like to order some blood tests to see to look for any signs of anemia, to check for any signs of infection, inflammation, check your kidney, liver function, and some inflammatory inflammation markers. We're gonna do a urine test as well, if that's okay, a urine dipstick.
That's
Yes.
fine.
Okay, so Rachel, from what we have done so far, what we have discussed and what we have done so far, it seems to me that what you have in this moment is something that requires admission. So we need to keep it today, and it seems to be some sort of infection.
Okay. All right.
Yeah.
As long as,
So.
as long as you feel the pain, that's fine.
So we are going to admit you. We are going to put a cannula. So we need to give you some medication to the drip. Mainly sorry, we're going to give you some painkillers. Is that okay?
Okay.
Yes. We also need to do further investigations. We need to do some imaging tests. So we can know a better picture of what's going on.
Okay.
Is that okay for you, Rachel?
That's fine.
Yeah. Yeah. I will also discuss this case with my senior. And
On to the next station.
thank you.
Done.
Thank you. Patricia, are you able to see the screen?
Yes, I didn't ask about on this, but I was seeing it.
Okay, fine. I just wanted to make sure that you were seeing the screen. Fine,
Yes.
perfect. Well, the rest of the team can give you lovely feedback. Thank you. That was very nice.
Yeah.
Right. So what do you think the diagnosis is?
It's either hepatitis or parotitis.
Yeah, exactly. How would you explain to the patients what she has?
Sorry?
How would you explain? Oh, sorry. How would you explain to the patients about the diagnosis?
I will say that it is in, well, I guess I will say I will go simple. That's an infection, or it seems to be infection in your liver or in your pancreas.
Okay. With an
Then-
elevated amylase, it's normally there's like 90% chance it's pancreatitis.
Mm.
So you've asked perfect pain, like focused pain history. You've ruled out pregnancy. You have ruled out urinary symptoms, which is brilliant. You've ruled out all the red flags as well. So I've got no problem with your history taking. But just towards the end again, be more confident in your management. But I think you're very nice. You've done very well. There's no problem with passing this case in general. But it's just about getting a better score. But I think you've done well. Okay, just a few important bits about pancreatitis is in terms of history, you will need to have some idea about the causes of it. Most common causes will be gallstone. That's why this case patient will have jaundice, and you've requested additional scan, which is brilliant. Alcohol will be important bit. So that's the social history that you have to ask during the focus history taking. And there's other medications. If you have time, you need to ask any previous surgeries. So abdominal pain, you have to ask. If it's a more surgical based cases, that's in general. If you're coming across a more surgical based cases, always ask about any previous surgeries, because sometimes patients will represent with adhesions, or patients who have had recent surgery will present themselves again with abdominal pain. So it's important to know sometimes they have got complications after the surgery. They will tell you, but not in this case, but in general, sometimes they'll tell you, I've had a surgery last week. So you sort of have more idea what is happening. But again, you're confident, you've got interpersonal skill, you do address what the patient's concerned about, and I think you've done well. Well done. But always in pancreatitis, give a lot of fluids. They are normally very dehydrated, and they will need very strong painkillers as well. But like this case, the patient told you, I've had some paracetamol, so you can address this. I know you've had some paracetamol, it doesn't help with the pain, so I'm going to start you on really strong painkillers to get the pain under control. I will give you some fluids through the drip, and then we'll look into what is the cause of the pain. But if you already know, just say, I will order more scan. I will order some scan, some imaging to find out the cause of this pancreatitis. In terms of pancreatitis, you can explain as there could possibly an infection or an inflammation of the gland in your tummy. So yeah, that's pretty much it. Any other comments?
I thought you had great interpersonal skills. I really enjoy your history taking. You did it really well. You used layman's terms this time around, which was great, and you came across as more confident, and I feel like your history was a bit more organized than the last case, which was good. Just as a fun fact, there is a mnemonic you can use for acute pancreatitis. You probably know this. Get smashed. You could just like go through everything. Yeah, but I was happy with you just now.
Thank you.
Rajni, any comments?
No, I think you pretty much covered everything. Only one thing I would add is if it's acute pancreatitis, just make sure to add the ABG in the plan as well. That's all. Otherwise, you covered everything. Your history was much better than before, and then you kept in mind that it's a female patient, It's just good to rule out the other things as well. Although the amylase is kind of like a giveaway. Was this amylase visible in the beginning? Sorry, I wasn't sure.
Yeah. So
Oh, right.
I mean, it's not ideal, but I've put them all on the slide just so.
Okay, it's fine. Yeah.
But during exam again, if you don't ask for them, you're not gonna get.
Yeah. Also, during the exam, there's another thing which I kind of like got caught out. So if you don't say what test you will do, they won't give the results. So you won't be able to move on to the next stage. So you have to make sure you specify what test you will be doing. So they can give you the results with, oh, okay, that's what it is. So then you can rule out things. Yeah, I think apart from that, yeah, it was much better than the first one. Much improvement. Yeah.
Cool.
Thank you.
All right, then. I think that's all our 3 cases tonight. Thank you very, very much for everyone who's attended the session. And it's been a pleasure delivering all these sessions. If you need to refresh any other cases, you can always go back and watch again. There are all the videos are on demand on MEDALL. I think I've pretty much covered every bit of it. And if you've got any questions, you can get my email address. I'll be happy to answer them for you. I'm just going to put it on the comment box below. There we go. Right, and thank you, teams, for organizing this and facilitating it. It's been very nice. Have a good evening, everyone. Thank you very much.
Thank you, guys. Take care. Bye.
Bye.
Bye.